Sound check.
Hi, everyone.
Say it again.
Hi, everyone.
What's your name?
Hi, everyone.
And wave to the camera. Wave.
Hello.
Nice job. Are you done?
Yes.
Okay. Nice job. How you doing, everybody? Dr. Nathan Thompson here with the Wellness Way Yorkville. Happy Sunday, guys. Yes, I know I am going on live on Sunday. I'm not going to make a habit of it, but I know I have some family commitments tomorrow night. That always comes first. So I wanted to make sure I got this in for you as well. Going to go through a lot of important information with you, maybe things that you haven't thought about in the past in regards to type 2 diabetes. So the title of tonight is Type 2 Diabetes in 2025. Here's where I would start. Okay, here's where I would start. I'm going to go over some things that probably you've never ever thought about, and also probably something your doctor has never thought about as well. But I'm going to be going over 5 things that you really need to start working on. And I'm also going to go over some of the first line of defense medications that doctors prescribe, known as metformin, and why it just doesn't move the needle, but lifestyle absolutely can. So if you are watching right now, just say hello. Put that in the comments. Let me know also where you're watching from. I know that right now we're broadcasting live to YouTube, to Facebook at Dr. Nathan Thompson, Facebook at The Wellness Way Yorkville, YouTube, and then also the Rumble platform, although I can't see comments on Rumble. But I can on all the other ones. So please, guys, make sure that you say hello. Let me know also where you're watching from. And if you're also watching replay, also just put in the comments replay as well, so that I know that you're going back and watching it. I always get a kick out of the number of people that watch from so many different areas, so many different countries as well. So I love to see where people are watching from. And I see that, we already have people who are putting that in the comments. So thank you very much for participating. So type 2 diabetes or blood sugar issues in 2025, here is where I would start. Now, one of the things just to preface this, there is a difference between type 1 diabetes and type 2 diabetes. Type 1 diabetes is an autoimmune condition in which the immune system, due to some trigger to the immune system, has actually caused damage to the pancreas. And, these individuals can't produce insulin, which is actually causing issues when it comes to having elevated blood sugars. But then you have type 2 diabetes, in which your pancreas can respond by releasing insulin, but you're extremely insulin resistant and it can't keep up with a lot of factors, whether it's insulin resistance, can't keep up with the sugar intake, that's happening. And that would be considered type 2 or non-insulin dependent diabetes. So I'm going to talk to you about testing. I'm going to talk about diet. I'm going to talk about some types of exercise. I will be talking about, short chain fatty acid production, your microbiome. And also I'll talk to you about some results that come from what doctors are utilizing as a first line defense type 2 diabetes and why it just doesn't move the needle. I'll show you actually why here in just a second. So when we talk about the Wellness Way and the Wellness Way approach, the whole premise behind the Wellness Way is that we think and act differently to solve the health challenges that others can't. And in fact, I've had people who have, anytime you catch any flack, from doctors and things like that, I want you to think of this. No one's coming to me first. In fact, they're coming to me almost as a last resort because everything else that they have tried, traditional approach, medical approach, or whatever, has absolutely failed them. And then finally, they're just kind of throwing their hat into and saying, all right, well, if you can help me, I guess you can help anybody. And so, but the thing is this is why prevention, guys, is so important. But if you are in a pinch, this is why nothing will ever change unless you start changing yourself. In fact, that this is why we say we think and act differently to solve the health challenges that others can't. And in fact, we have solved health challenges when people were just, doctors couldn't figure out what to do with them. And then they change some things and then they start getting better. And then the doctors call up and then they're like, what on earth did you do? I need to know your protocol. And in fact, they don't really want the protocol. And, and they get dismayed once they realize this was largely based off of lifestyle, not based off dump a bunch of supplements or anything like that. But that's how doctors think. They just think it's some kind of supplement, or medication or, something like that. And in fact, we're here not to manipulate, but to restore, to have you restored back to physiological normal. And this is why I will always say, and this is what doctors can't understand, is that you have to work on building health and not treating. Everyone wants to treat things, but in reality, if you look at some of the things that I'm going to go over, it really is about building health and not trying to treat sickness, illness, and disease. This is why some of the things I'm going to go over with you tonight are going to be pretty universal, whether you have type 2 diabetes or not, things that you should be focused on and not waiting until you have the disease in order for you to decide that you're going to start to change some things. So guys, I will actually tell you this. If you suffer with blood sugar issues or you suffer with issues when it comes to weight loss resistance, or whether it's immune system issues or problems conceiving or thyroid issues, autoimmune conditions, hormone issues, whatever they might be. And if you want to start getting your health back and you're from the Chicagoland area, then one of the things I want you to do right now, and in fact, I know, guys, there's so many people that watch this and they don't act. And I will tell you this, if you don't act, nothing will change. This is your call to action right now, is to start to act. The first thing that I want you to do is get registered for our inflammation event. If you're from the Chicagoland area, you want to work with the Wellness Way approach, you want to work directly with me one-on-one, then this is what I want you to do, is get registered for our next event, which is the inflammation event. This is when we register people as new patients. And in fact, when you attend the event, we have a gift for you as well. So, from a cost perspective, it is always going to be cheaper if you come to the inflammation event. And also, it will start to change your mindset so that you can start thinking differently. So get registered for that right now. All you have to do is if you just click on our Linktree profile, that's in all of our social medias. And if you click that, you will see the inflammation event, work with me in person. And you will see that start to shake. You see that jiggle a little bit just to get your attention. Click on that. That will take you to Eventbrite. That'll take you about 60 seconds to register for that event. And when you do register, my staff will reach out to you. They'll confirm your attendance at that event. The only thing that we ask is if you register, that you show up, because nothing happens unless you show up. 90% of the success, guys, is just you just showing up. Great things happen when you do, in fact, show up. But you also see that we have tons of other things on there, like the sleep challenge that's occurring right now within the Wellness Way, the October 2025 Sleep Well Challenge. And you'll also see some free resources and workout books. You'll see our t-shirt store up there. Don't forget about the t-shirt store, because the most popular t-shirt that we ever created, hands down, was our Mandate Burpee t-shirt in defiance of our wonderful governor here in Illinois, J.B. Pritzker, who really does need to do a lot of burpees. So make sure that you check that out. But this is how you register for the inflammation event. Now, I made this announcement last week. I'm going to make this announcement again. Okay. So yes, we are opening up our schedule to remote consults, working with you from remotely over the phone, and so it doesn't have to be in person. So we did open up the schedule last week to be able to do that. However, this is only open to men only, and men who live in the contiguous United States, so in the 48 states. This is why, as far as doing labs or getting things shipped to where you live, it doesn't work very well when you're from a different country, or if you're from Alaska or from Hawaii. It can be very, very difficult. So if you're from the contiguous 48 states and you're a man and you want to work with the Wellness Way approach, whatever it might be, please reach out to us. Call our office, 630-553-6149. And my staff will give you a call back, and they'll get you set up for your first consultation with me. So type 2 diabetes in 2025, here's where I would start. Okay. Now, when I go over this is going to be pretty universal, but I guarantee you, when you talk about type 2 diabetes, people just think that it's an issue just with obesity. It's an issue with eating too much sugar. And yes, all of those things do in fact contribute, but I'm going to show you some things that not a lot of people actually are looking at as well. So here's where I would start. First thing that I want to go over with you is why are elevated blood sugars so damaging? Are elevated blood sugars extremely damaging? Yes. Elevated blood sugars are so damaging, but what happens? Why are they so damaging to the body? Well, the first thing you always have to consider when it comes to having elevated blood sugars, you can measure this when you look at fasting blood glucose, or a better way to do it is to look at your hemoglobin A1C, because basically it's looking at a 90-day blood sugar average. And also basically what it's looking at is it's looking at the degradation of red blood cells, because that is soft tissue. And so high blood sugars damage soft tissue, so it causes degradation of those red blood cells. And so they measure the damage to those red blood cells as a percentage. But if you have elevated blood sugars, what happens? Why is this so damaging to your body? Well, the number one thing that really will start to damage is the nerve system. It starts to damage nerve system. And you probably have heard of diabetic neuropathy. And so elevated blood sugars, because what happens is the nerve system really isn't dependent on insulin. And so it just takes in all of those blood sugars, and all of that sugar that's going into the nerve system, it can just cause a lot of collateral damage to those neurons. And this is why a lot of people with blood sugar issues start to have problems with diabetic neuropathy. Okay. Number two, it really will start to damage the immune system as well. I went over this, in the past about the role of sugar and how high amounts of sugar damage the innate immune system, specifically neutrophils, which is why if you look at people with chronically elevated blood sugars, why they have such a poor functioning immune system, and why they can have so many issues when it comes to infection and things like that. One thing that a lot of people just don't take into consideration is that it really damages any kind of area in the body that contains a lot of soft tissues. Okay. And why it damages this is because elevated blood sugars cause what's known as advanced glycation end stages, otherwise known as AGEs. And so what happens is that the sugars tend to cross-link with a lot of connective tissue, And then what happens is it starts to damage the connective tissue and then forces the immune system to have an inflammatory response to start to clean up some of those things. And this is why it affects the vascular system. This is why it affects the joint capsules. This is why it affects the kidneys. This is why it also affects the retinas. And if you look at a lot of people, diabetic retinopathies, it really affects the retinas and it affects things systemically inside the body. And so elevated blood sugars is no joke. And if you have chronically elevated blood sugars and you're not getting that under control through lifestyle, this is why it has the potential to really destroy you and also chronically inflame you. It will cause so much chronic inflammation because of damage to so many different areas of the body. And I'm going to give you a perfect example because this right here, if you look at this, here's an individual that came in with a lot of chronic joint pain. He just said, oh, everything hurts in my body. And he said, I also have, I'm in the process of being in kidney failure. So he had really a lot of damage to the kidneys. He was also a type 2 diabetic and was injecting insulin. Oh, man. And so when he took x-rays, he also had a surgery, try to open up the arteries that supply a lot of the blood to the legs. And in fact, when I looked at the x-ray of him, and every joint in his body hurt. Now, if you look at this x-ray from the side, this is a low back x-ray. So here's his belly over here. And then this right here, this is the back part of the bones and the lower part of the spine. So if you look at the x-ray structurally, there actually was not a whole lot that was going on. However, if you start looking at some of the soft tissues, you start seeing the presence, you see these on the arrows, the presence of osteophytic spurs, which is really just calcification taking place in the ligaments that are connecting the spine. And then if you look at this big area right in through here, this is a large vessel known as the descending aorta that supplies a lot of the vascular supply to the legs. You're not supposed to see this on an x-ray unless it starts to calcify. So if you look at this and you can see how calcified it was, you can see that this person had a tremendous amount of inflammation going on. Because just remember this, calcification doesn't happen unless it's inflamed first. If it's inflamed first, then it starts to calcify. That's why you can see calcifications on the thyroid. If you start seeing calcifications within your vessels, that's a big problem that's going on. And this is why, they'll do a coronary artery calcium score, otherwise known as a CAC score. And, but once you already have calcification, you are very late in the ball game right here. So if you look at this, you can see this person had a tremendous amount of inflammation that's going on. And you know what I told him? I said, you have to get the inflammation down. And in fact, I told him, we're not even going to adjust you. You have so much calcification that's going on that it's really just not going to move the needle all that much. However, you said you really need to get the proper testing done because doctors are just dumping a bunch of insulin and it's not moving. You still have elevated blood sugars. It's still damaging the tissues. And so you need to do this from a different approach. You can see he's got a lot of damage taking place due to chronic, unrelenting inflammation that can be due to having chronically elevated blood sugars for a long period of time. All of this, what it leads to is it leads to joint destruction. It leads to increased pain. It leads to poor kidney function, poor vascular function, elevated inflammation, poor immune function, and yes, accelerated aging. So if you want to age faster, then have elevated blood sugars. Elevated blood sugars will make a person age so much faster. And so because it's going to affect soft tissues, which your soft tissues also are your skin too. So it causes all of those issues. But a lot of times doctors they're not telling you all the things or explaining to you why this can cause so many problems. Now, if you look at the Journal of Neurology of 2014, I've talked about this in the past, but they said association of type 2 diabetes with brain atrophy and cognitive impairment. So when you talk about elevated blood sugars, yes, it causes accelerated shrinkage of your brain mass. And in fact, if you go back and look at the article, it's not even you being pre-diabetic that's causing accelerated brain atrophy or loss of brain mass. Actually, where that's at, I think it was at like 5.4. So this is why, I think they should be lowering down pre-diabetes and not saying, hey, it's at 5.7, 5.8. That's when you really need to be concerned about it. Because when you're talking about an accelerated rate of brain atrophy and not even being pre-diabetic, well, that can be pathological at that point. So this is why having very low blood sugars can be very beneficial for people. So because it's causing brain atrophy, and everybody talks about dementia or Alzheimer's disease and things like that, and they're not really moving the needle, and they're talking about awareness, but they're not talking about prevention. This is why I think awareness is so stupid, because they're just, let's make you aware of it, but let's talk about absolute prevention and about moving people so that they never get it in the first place. All they're talking about is early detection of disease that's already there. But as far as I'm concerned, you should be more concerned with, how do I never get it in the first place? So here's where to start when it comes to type 2 diabetes and things like that, and what you should be doing in order to start moving the needle, to start working on getting your health restored. The first thing you should always do is you should work on testing. You should start looking into getting the right testing. So this is why A1C should be measured. It's a 90-day basic blood sugar average. This is why also you need to be getting your insulin levels measured, because many times I'll see people with very high insulin, but their A1C and their blood sugars haven't elevated yet. In fact, they have to get to the point in which they don't respond to insulin anymore, because insulin is the hormone that acts as a lock and key. When it attaches to the cell, it opens up receptors for glucose to be able to enter into the cell. And so once those receptors just get bowled over and they stop responding, then the body will need more and more insulin in order to get that sugar within the cell. And at that point, you call it insulin resistance. And then you'll see your blood sugar start to go up. And so this is why getting A1C is very important. You should actually get your fasting insulin levels measured as well. And then a lot of people don't realize this, but a stool test can be very beneficial for people with blood sugar issues, for the reason of measuring something known as short chain fatty acid production. And I'm going to show you a clinical example of an individual who came into the office. Now, this person was not, I would not by any stretch of the imagination call this person obese. However, something happened when he came in. He was having a tremendous amount of gastrointestinal issues, and the doctor couldn't figure out what was going on with the gastrointestinal system. So he just threw up his arms and just decided to take out his gallbladder. You cannot make this stuff up. Only to realize after getting the gallbladder out, all the gastrointestinal system issues continued to persist. So we did I tested some hormones, tested blood sugars and things like that. Yes. However, when you look at the stool test, you can see, yes, the gastrointestinal system is extremely inflamed. You can see that he's carrying infection within the gastrointestinal system, mainly because it's very easy to have pathogenic bacteria within the gastrointestinal system, because all of that helps to water what's known as the microbiome, large amounts of bile, fiber, things like that, stomach acid. But then if you look at this, you can see he had pathogenic bacteria. But I want to show you something. When you look at this, you see he had very, very low short chain fatty acid production. And if you've ever heard of butyrate concentration, very, very low overall short chain fatty acids are very, very low. And people say, well, what are short chain fatty acids? Basically, what this is you need two things. You need the cells, you need the microbiome, number one. Number two, you also need the fiber in order to feed that microbiome, so that its metabolism, as it metabolizes fiber, it produces something known as butyrate, which can help with satiety. It helps with blood sugar control, helps with that. So this person was already pre-diabetic, and I looked at this and I'm like, well, here's one of the contributing factors. And in fact, he needed to lower down his sugars quite a bit, number one. Number two, but he also needed to be getting high amounts of fiber and also high amounts of bacteria within the gastrointestinal system. But one of the things you really have to do first is really start changing the environment, which is why if he didn't have a gallbladder, we started putting him on a bile acid replacement right away in order to start replacing the bile that he cannot start to squirt out of his gallbladder, only because it wasn't there. And so that was affecting a lot of the digestive process, but also affecting the overall health of his microbiome. Okay. Now, if you go into biochemical pharmacology, they even talk about this, guys. So when short chain fatty acids meet type 2 diabetes mellitus, revealing mechanisms and envisioning therapies. Okay. Here's what they say. Evidence is accumulating that short chain fatty acids produced by the gut microbiome play pivotal role in host metabolism. They say it right there. And in fact, rather than say anything with lifestyle, they quickly want to go to this. This is why we need to start developing drugs and things like that. And it's not, guys. This is things that you can handle with your lifestyle. But they talk about the microbiome. They talk about short chain fatty acids and having a healthy microbiome, how it actually does cause some issues with blood sugar control. A lot of times, if someone comes in and they're having blood sugar issues, rather than really say, we're changing your lifestyle, the doctor will just say, oh, change your diet. You need to change your diet, but then never says anything about what specifically to do. Not here's exactly what you need to start doing in order to start getting this under control. It's usually just, hey, your blood sugars are elevated. You need to eat less and just start controlling your diet. And you just open this up on your, on your app, and the doctor just made a note with that. But there's no one-on-one. I'm going to show you exactly what you need to be doing as well. And usually they'll start adding in some of the medications. And here's one of the things known as metformin. Okay, I don't know if any one of you have been on metformin on the past, but if you look at metformin, this is usually one of these first line therapies that they're doing when people do have type 2 diabetes. Okay. So if you go on to WebMD, one of the things they say is metformin works by helping to restore your body's proper response to insulin you naturally produce. It also decreases the amount of sugar that your liver makes and that your stomach and intestines absorb. Okay. So it's just helping with, it's just starting to, it's starting to manipulate the body, which is why they're just is not going to have very good outcomes long term. I'll show you here in just a second. So they did measure this. This comes from the FDA, and this was them looking at glucophage, otherwise known as metformin. Okay, so if you look at this was a study that they did that involved people for 29 weeks. This was well over a half a year. And so they looked at the people who took metformin, and you can see this is what their blood sugars were 241, which is entirely way too high. And you can see with metformin, their fasting blood sugar went down 53 points. Okay, so it went down 53 points. Then you look at them taking metformin for 29 weeks. Then you look at their hemoglobin A1C, which is 8.4, yes, in diabetes. Then they took it, and it went down to 7.0. So there was a 1.4 percentage drop. So it went down to 7.0. And then you look at how much weight they lost, and they ended up losing 1.4 pounds being on this medication. Then if you look at the placebo, you can see that, yes, the changes were, they actually did change. Yes, just thinking they're on the medication. But you also see them thinking they're on the medication, being the placebo group, they ended up losing more weight. So go figure, right? But look at this. This is the gold standard. This is what they say. This is the treatment for type 2 diabetes. And in fact, when you look at the changes after well over 6 months, congratulations, you are still a type 2 diabetic. Do you realize that you look at the changes, you're still in diabetes, even though you've been taking this medication for 6 months, okay? So the results are paltry at best, okay? Now, if you go also onto WebMD, you can look at some reviews for metformin, okay? You can look at the reviews that people have, and if you look up metformin, I don't know, it may make you laugh. It also may make you cry. I did a little bit of both because there's some pretty funny reviews that are going on, but in the same aspect, I know that these people are suffering, that they're being misled, and as a result, the doctors are they're just trying to put out the fire, but they're giving things that are just causing so many issues. So if you look at WebMD and you look at metformin, you can see it has very negative ratings, on there. And so If you look at here, this person said, I was diagnosed with type 2 diabetes in March and have been taking metformin for 7 months. Did not control my blood sugar effectively, and the side effects were almost debilitating with severe chronic diarrhea. In fact, that's one of the biggest effects that people have, is that people do, in fact, start to develop a lot of gastrointestinal upset and also severe diarrhea. And the reason why is because a lot of times when people have type 2 diabetes, they also already are coming in with a lot of gastrointestinal issues that they need to start handling. Here's another review. I have IBS. This prescription drug caused me to have severe stomach pain and diarrhea. Here's another one. If you have any prior GI issues, do not take this medication. In the days I took it, I had multiple issues with almost any GI issue you could imagine. So this is why if you look at the overall rating, it's very, very poor. Very, very poor. Yet doctors are still they're just dumping this into people. And I remember I had an MD who came to me, and she said, I don't want anybody to know this, but I am just absolutely clueless on what to do. I'm throwing metformin at type 2 diabetics. It's just making them worse. I'm putting just tons and tons of women on birth control. It's not helping. I just really want to learn how to help people from the standpoint of the wellness way approach. And you know what? She didn't last very long. And the reason why is because she just realized is if she did anything that went counterculture to what the narrative says that she must do as evidence-based medicine, she would lose her license. And so she just walked away from that. So you can see not very good reviews with some of the premier medicine out there for type 2 diabetes. And in fact, if you look at this research article from Diabetologia, this was in 2016, so almost 10 years ago, metformin and the gastrointestinal tract. This is well known, guys. This is well known. Here's what they say. Metformin is an effective agent with a good safety profile that is widely used as a first-line treatment for type 2 diabetes. Now listen to this. Yet its mechanism of action and variability in terms of efficacy and side effects remain poorly understood. They just don't know kind of why it works or why people are having so many side effects. Although the liver is recognized as a major site of metformin pharmacodynamics, recent evidence also implicates the gut as an important site of action. Okay, so yes, metformin does in fact really, really affect the gastrointestinal system, especially. So if you go on to with this article, they go on to say this: metformin and the gut microbiome. The gut microbiome and the microbial genome are all areas receiving increasing research attention and are now considered as environmental factors that contribute to the development of many diseases, including obesity, metabolic syndrome, and type 2 diabetes. Okay. So if you have type 2 diabetes and the doctor is not looking at the gastrointestinal system, they just aren't up on research. Okay. They're just not reading it. And probably the pharmaceutical rep that comes and gives them lunch still hasn't told them about this as well. So, and studies in China and Europe have described gut microbial dysbiosis or abnormal gastrointestinal bacteria in association with obesity and type 2 diabetes. Okay. Now, here's one of the things I want to say. Your first line of defense is you. It's not in a pharmaceutical. Your first line of defense is you. It's going to be you. So second thing that I would start at is first get the right testing done. And then number 2 is going to be your diet. What is the best diet for people with insulin resistance, type 2 diabetes, and blood sugar issues? Well, it's going to be a no sugar diet. And if you don't know what a no sugar diet is, I've talked about this for a long period of time. Just go onto our Linktree page and you will see the no sugar diet. Or if you go to our Wellness Way store, you'll see the no sugar diet companion guide. And you can order that. And it's a wonderful guide with tons of recipes that show basically the need for lowering down your sugars tremendously. So the no sugar diet is not a no carbohydrate diet. It is a high protein, high meats and veggies, and also high fiber type diet. Okay. Only because we do realize within the Wellness Way that the fiber is going to be very important to help with blood sugar regulation. So a no sugar diet, I would start there. I would start massively increasing your fiber. Probably need to be on some level of probiotics and or fermented foods in order to help with short chain fatty acid production. But I'm not going to go over the no sugar diet because, at this point, if you've been following for a long period of time, you should know exactly what it is. And if you don't know what it is, then just make sure that you go onto the Wellness Way, and look on there, type in the Wellness Way no sugar diet, because we have no sugar January. We've had no sugar for 2 months. I mean, probably 6 times over the course of 3 years. And so, at this point, you can go ahead and download a lot of those resources on the wellnessway.com. So you have to start with your diet. Okay. And this is why one of the things I've always said, and I didn't come up with this quote, this comes from Greg Glassman, who is really making a concerted effort to help people with their lifestyle, to help people have healthy longevity for as long as possible. That's why he started CrossFit, and CrossFit was for everybody. It was not just for the young people. It was literally for everybody. And he said it really does start with what you are eating with chronic degenerative illness. And he said, eat meats and veggies, nuts and seeds, some fruit, little starch, and no added sugar. Keep intake to support exercise, but not body fat. And in fact, I think that this is, unless you are ruling out specific IgG and IgE mediated food allergies and stuff, this can be a tremendous start for someone without any kind of testing to eat meats and veggies, nuts and seeds, some fruit, little starch, no added sugar. Keep your intake to support exercise, but not body fat. And that's, even though it's very simple, it's very elegant the way that it was stated. It is profound the more that I start to see people's labs and to see when they start doing that, the profound effect that it can have on their life. Okay. So you need the right testing. You need to start changing your diet. There's no doubt about it. But then also you need to start changing your lifestyle. Here's one of the things that I would make sure that I would be doing is, number one, make sure you're getting 8 to 10 hours of sleep per night. And the reason why is sleep is there for repair. It's there for healing. Sleep is there in order to build up your hormones. And I guarantee someone's gonna be like, oh, I don't sleep very well. And this is why we have the Sleep Well Challenge going on in October in order to help people develop better sleep habits. But I will tell you this, when you do have blood sugar issues, you do not sleep very well. In fact, many times people will have what's known as a cortisol awakening response at 2, 3 in the morning. And in order to get themselves back to sleep, many times they just have to dump a bunch of sugar into their body that then puts them back to sleep. But this can be a sign that, hey, your blood sugars aren't doing very well, and you need to get this under control. So I would be sleeping more. And one of the other things too is because, last night I got probably 10 hours of sleep. And since, over the last 2 years, I said I am 100% committed to getting enough sleep for repair and recovery. But one of the biggest changes that I've noticed is that my hunger just went down pretty dramatically. So if you want your hunger to get under control, get rid of sugars and start sleeping more. And then you'll notice over time that your body will become less hungry because it just starts to, some of the stress hormones, some of the hunger hormones start to go down. So you need to be getting enough sleep. And number 2, I would be doing high intensity, short duration training. You really do have to do high intensity, short duration training. So Saturday I was in the gym, Sunday I was in the gym, Tuesday I'll be in the gym, Thursday I'll be in the gym, and I'll always do some level of high intensity, short duration training. But then I'll also do some level of heavy weightlifting, things like pressing, pulling, squatting, things like that, in order to build muscle mass. So I'm really interested in building muscle mass. And in fact, many times, when people start seeing their blood sugars start to come down, start to get under control, I say, if you want to do a better job, you're going to have to start working on putting on some muscle mass. And the reason why is that muscle mass is metabolically active tissue. The more muscle mass you have, muscle mass doesn't become insulin resistant. And in fact, the more muscle mass you have, the better you'll respond to sugars. And this is why, last week when I went over, some of these weight loss medications, why they can just be exacerbating some of the problems, with that, because it will cause so much, chemically induced anorexia that you'll lose so much muscle mass as a result. And then you'll just run into some problems with that, because if you start losing muscle mass, you are losing metabolically active tissue that has a direct correlation with you being able to control your blood sugars. And so this is why you need to be doing high intensity training, and you also need to be doing heavy weightlifting, pressing, pulling, squatting, things like that will have a profound benefit on your system. And then number 4, with lifestyle, you probably will need some support that's going on. I don't want people to become lazy supplement takers. However, I will actually say this: if you got some issues with having elevated blood sugars, I've done a whole live video on thiamine and why thiamine can help to protect the nerve system when it's undergoing high blood sugars, and why that can damage the nerve system. And in fact, especially for, diabetic neuropathies and things like that. So high amounts of thiamine or vitamin B1 can be of great benefit to a lot of people. And so people say, well, how do I get that in? I'm like, well, desiccated liver is high in thiamine. So I would be on desiccated liver, and I'll take that every single day, only because I don't like to eat liver. But then you got other things too, like Oregon grape, which, yes, it does contain berberines. But I think Oregon grape, one of the best things that it does is it just helps. It's usually one of the most effective things when people are running, pathogenic bacteria within their gastrointestinal system. And then you also have Gymnema, which is known as the sugar destroyer, because Gymnema also does slow down the absorption of sugars, from the intestine. It also can help with insulin signaling within the pancreas. And the other thing too, that why Gymnema can be so beneficial is, take a teaspoon of it, swish it around your tongue for, about 10 seconds, and then swallow it. Go eat some sugar, and you'll realize you won't be able to taste it for about 3 hours. Okay. So Oregon grape, Gymnema, milk thistle especially can be a benefit, especially if you do have, like fatty liver disease. Schisandra can also be a huge benefit. I think almost every woman should be on Schisandra, but it's hepatoprotective, meaning it can increase melatonin levels, so it helps to protect your liver. Potassium is huge, because with fatty livers, usually most people are in fact very deficient in potassium. And just kind of a fun fact, potassium is needed for insulin secretion too. So low in potassium can also cause kind of a sluggish insulin response coming from your pancreas. And then also, if you're having some issues, with the gastrointestinal system, getting in some chicory root, fermented foods, increasing your fiber and things like that, can it be a great benefit. But notice I told you this, I called it support. It's there to support, not to replace your lifestyle. I want you guys to realize that. It's not to replace your lifestyle. One of the most powerful things that you can do is change your lifestyle. And then you're supporting the body with some of the things that are needed in order to help good digestion, good liver function, good gastrointestinal support, in order to help your body be able to heal and start to recover. So I went over labs. I went over diet, lifestyle, support. And then the last one is your mindset. Okay. The last one is your mindset. And I really do think when you go down to the nitty gritty of it, it probably is the most important one. The reason why I say this is this: you can't have the same mindset that created the problem long term. You cannot have the same mindset. Okay. And this is why I think people have such a hard time with weight loss and things like that, is they just don't have the ability to do it long term. And the reason why is because they never change up here. And so they just drag themselves for a couple of weeks or a couple of months. And then because they never change this, they just go back to their comfort. And then they just go back to the same destructive lifestyle that led them to get sick in the first place. And so this is why mindset is so important. You can't have the same mindset that created the problem long term. You have to change. And in fact, 15 years ago, a lot of people don't realize I was pre-diabetic 15 years ago. I was fat, lazy, and soft. I'll say that. I have no problem saying that I was. I'm not saying that you are, but I was fat, lazy, and soft. And you could see that in my life. So I changed this up here, and then I created the habits knowing I'm never, ever going back. I'm never going back to where I was before. And that's why I've kept everything off long term, and I've never, ever gone back. And yes, I do measure my blood sugars and insulin levels. I've measured it twice already this year. I've already measured those things. And you know what? I put on so much muscle mass over the last 15 years. Get enough sleep. I don't eat copious amounts of sugar. I just don't do that. It doesn't interest me. And I measure those things, and I'm doing fantastic doing that. But even I will keep myself accountable. But I do understand too, is you have to change this up here, because you can't be the same person that got yourself sick. You have to become a different person. Okay. Here's a final thought. Medicine appeals to people because I have a misspelling. Sorry. Medicine appeals to people because it appeals to your nature. Okay. And this is why when you look at some of these medical doctors and, the ones that are just peddling their GLP-1 medications, the ones that are doing, gastric bypass surgery, the ones that are just handing out medication like they're candy today, the reason why is they do a very good job. I want you to pay very close attention to this. They do a very good job of appealing to your nature. And you know what your nature is telling you? It's not my fault. It's not my fault. It's a disease. I just got bad genes from mom and dad. So it's not my fault. I just have some level of disease. And the doctors are there saying, yes, you do. You just have some kind of disease. It's not your fault. And so people want to immediately just just catch on with that, latch on with that idea, so that they then become a victim. They become a powerless victim. I do not believe that it's 100% a disease. I believe that there have been some things that were taught to you from a very young age that were leading to very, very poor lifestyle. No one taught you about anything when it comes to good gastrointestinal health. They sure as heck didn't tell you about high intensity, short duration training, weightlifting. They didn't tell you about that. And I sure as heck, your doctor's not going to be talking to you about that, because they're giving you a 5-minute visit, looking at your labs, and put you on a medication. They're not there to change your lifestyle, and you have to stop relying on them to change your lifestyle. This is why you need the wellness way in order to start changing your lifestyle, and you need to stop becoming a powerless victim. You need to stop with the victim mentality, and you need to start taking 100% responsibility for your life, for your health, and for your future. And you need to stop listening to these doctors who are just saying that it's a disease and there's nothing you can do. I'm your savior, your medication or savior, even though I just went over the medications, that the effect of it and the benefit of it are paltry at best. No one's coming to save you. You have to start saving yourself. So it's time for you to start owning up and start living your life in a way that's going to create health and not something that's just creating disease. Stop giving so many excuses and start manning up and start taking responsibility for your life and for your health. And if you are someone who wants to do that, then get to the inflammation event that's coming up on Tuesday, November 4th at 6:00 p.m. This is an in-person event. If you're from the Chicagoland area, get registered for that right now. Quit dawdling and get registered for it right now. So all you have to do is just click on the Linktree profile on there, and you will see this show up. Click on that. It'll take you 60 seconds to register. And then if you're a man, you're watching right now, and you are a man, you're in the contiguous 48 states, call our office, get scheduled for your first remote consult with me. My staff will get everything squared away with that. And usually I'm handling most remote consults on Thursday morning. So please reach out and get scheduled for that right now. So guys, type 2 diabetes in 2025. Here's where I would start. And one of the things you'll notice is that this is pretty universal, clear across the board, because you don't have to wait until you have type 2 diabetes to start working on your health. I always say, why not just start it now so that you never end up getting there in the first place? But this is where I would start. And guys, if you found benefit to this, make sure you follow our page. Make sure that you like this video. Make sure that you share this video with other people in order to give them hope, in order to help give them a great future. And share this video especially too if you know someone who is sick and tired of being manipulated and not being restored. So let me ask you a question. Do you want to be manipulated, or do you want to be restored? Because we are doctors of restoration, and not doctors who just manipulate you with more drugs, more surgery, things like that. Yes, sometimes they are needed, but you know what? We are just now have become a nation of drug takers. And we need to start changing that and start looking at things from a lot different perspective, which I just went over the past 50 minutes or so. So guys, I appreciate you guys being on this live broadcast on a Sunday. Tomorrow I have a very, very important game to go to. My daughter starts regionals in volleyball. So Grace, if you're watching this, best of luck tomorrow. I hope you guys take it very, very far. So guys, be well, be blessed. I'll see you guys next week. If you have a topic in mind, just reach out to me. Let me know what you'd like that topic to be, and I will, as always, consider it. So guys, I hope you enjoyed this live broadcast. Please share this widely with as many people as you know. Please make sure that you follow our page. Be well, be blessed, and I hope you have a great week coming up. Be well, be blessed. Remember who you are.